Drug use vis-a-vis HIV/AIDS. Injecting drug users or IDUs is one of the known modes of transmission for the human immunodeficiency or HIV in the Philippines, which is the causative agent that can cause the acquired immune deficiency or AIDS. HIV is a blood-borne virus. It can be transmitted from one person to another through blood transfusion, sexual intercourse, exchange of bloody fluids, and from mother to child during pregnancy and breastfeeding. AIDS is a syndrome because it is a complex pattern of symptoms. AIDS is a disease which attacks and weakens the body's immune system. The Department of Health or DOH reported that around 13 Filipinos are infected with HIV/AIDS every day. From 1987 to 2013, there were more than 14,000 cases of infection, and the rate of infection in urbanized areas like Metro Manila is very high. The two most recorded means of transmission of HIV/AIDS are risky sexual behavior and sharing of needles through drug use. High-risk behaviors. Number 1. Injecting drug users or IDUs. The risk of getting HIV/AIDS through intravenous injection or IV is very high. HIV/AIDS are transmitted through needle sharing during sessions with co-users. This makes the person at high risk of getting HIV/AIDS. Number 2. Poor judgment and risky sexual practices. Drug intoxication affects the person's way of thinking. When you're high, it affects your decision-making skills, which can lead the person to perform risky sexual practice, then further provoke HIV/AIDS infection. 3. Prognosis of disease and drugs. Drug abuse and addiction worsen HIV/AIDS infection. A medical study has shown that HIV damages a larger percentage of brain cells and nerve cells among users of methamphetamine. In animals, viral presence in brain cells is more than the other cells in the body. Number 4. Delay in drug abuse treatment. Medical study has found that the longer drug users delay drug abuse treatment, the higher chance of getting and spreading HIV. Delayed drug abuse treatment means the person will engage in more intravenous drug sharing and risky sexual behavior and practices. The earlier a drug user seeks intervention and treatment, the better the chance of not acquiring and spreading HIV/AIDS and other diseases. Drug abuse treatment also educates and counsels the user and the family about the risk of drug use and abuse. Effects of drug use. Number 1. Effects of drug use and abuse on the family. Broken and unhappy family ties. Ignored duties and responsibilities. Financial constraint due to drug dependence and addiction. High cost of drug treatment and rehabilitation.